Then I think that takes the burden of the state a bit. And since the church would take the initiative, it can be seen as a kind of way of reducing the burden on the government. And so there is a interplay in this unity, fostering one goal for one purpose.
Hello, my name is Uwazedehe. I'm from University of Leeds in England. My question is actually for the pastor from Liberia. Actually wondering, you mentioned that pastors need to be trained on health issues and all of that, and you also highlighted when a patient comes into the church when he has a fever or he has some illnesses and he wants to see the pastor. But I'm wondering, if a pastor is trained and he has that experience, I'm not going against the pastor being trained, somebody that walks into a church based on his faith from the teaching, how do you think the pastor can really handle that? Because if the pastor starts talking to someone who is kind of building up his faith about, I'm trying to marry that, telling the person who has been preaching to on the pulpit about faith and exercising your faith, trying to tell him to go back to the hospital, which I'm not against. How do we marry that with the Christian faith? How do we build their faith? How do we make them stand and also build the other people? So I don't know if you can say something about that.
Yeah, I think the thrust of my presentation is that there's a need to not just focus on the spiritual aspect, but there's a need to blend the spiritual aspect as well as the physical aspect. Or you can have a new believer coming in that need to be strengthened. The person knows that the pastor, has certain level of anointing and they can handle certain issues, and the person can recognize the fact that the faith can be built up. But having said that, it is clear that the pastor should recognize that the condition of the person needs a medical attention and not just a spiritual attention. So even though you apply this faith method by praying for healing, for God's intervention, but you should direct the person to the hospital as well.
Also, I think that as Christians, we don't define many words in a manner that's understood. Healing for a person who's not whole is it's to make them whole. Wholeness does not mean that you're cured. Healing is to make you whole. So I can make you whole in the spiritual sense and give you the faith to understand how to move forward and to continue your praying. But your actual cure could come from the doctor. It could also come from God. But it's recognizing that when God heals you, your wholeness could just be that you're given the strength to carry on with this illness or disease for your life. But it doesn't mean that you're cured. It means that I've made you a whole person and that you can now stand in recognizing that I have this challenge to overcome.
I think there is a real problem often with the way we train pastors, with a narrow understanding of what it is to be a saved person, because we separate the body from the soul. And so evangelical pastors particularly are trained, go for souls, go and save the souls. But that is misrepresenting what God created the human person to be, which is body, soul for relationships. So we have to treat the person, whether they are spiritual problems or physical problems, as body, soul, and relationship. So it's a question of what they call theological anthropology, what God created us to be. And often when you analyze the problem, it's a theological anthropology that is narrow or weak.